Hi everyone, I'm Wang. Today I gonna talk about a powerful new drug called Enfortumab Vedotin, aka Padcev. This video will take you about 10 minutes and I'll mostly mention the bladder cancer, the previous treatment methods, Padcev and its functions, and the conclusion in this video. Hope you enjoy. According to statistics from the last decade, there were more than 10,000 new cases found per year in UK, 19 deaths each day, and more than a half can't live another 10 years in England. In the US, bladder cancer ranks 6th among the most common types of cancer list estimated for 2024 new cases. Bladder cancer progresses like a storm that starts quietly but grows more destructive over time. In the early stages, stage 0 and I, it begins with subtle yet troubling signs, such as blood in the urine, a red flag that hints at deeper issues. This is often accompanied by frequent and urgent urges to urinate, along with discomfort, much like a distant rumble signaling an approaching storm. As the disease advances to intermediate stages, stage 2 and I, it intensifies. The blood in the urine becomes more persistent, and pelvic pain grows sharper, reflecting the storm's escalating intensity. Difficulty urinating and discomfort indicate that the cancer is penetrating deeper into the bladder and nearby tissues. In the advanced stage, stage 4, the impact is severe. The storm reaches its peak, with heavy blood loss and intense pelvic pain overwhelming the body. Back pain, drastic weight loss, and extreme fatigue are like the full force of a storm, causing widespread disruption. Swelling in the legs and potential pain from cancer spreading to other organs only add to the destructive force, leading to a severe and unrelenting impact on the body. The mainstream strategy for bladder cancer treatment includes surgery, radiation therapy, chemotherapy, and immunotherapy. Surgery such as TURBT is the most direct way. When you find something bad, just cut it off. Although it may bring little side effects, but you need to pay the price by losing a part of your body forever. Yes, today's technology may allow you to have an artificial replacement typically borrowed from your testimony, but it doesn't work that well, does it? What's worse, it can't beat bladder cancer at late stages and it has high reoccurrence risk. Then comes the radiation therapy. When it comes to radiation, what comes to your mind? Nuclear weapons, Chernobyl, or the Hulk? I guess that's not something pleasant. Indeed, radiation therapy provides a direct but non-invasive way of killing your cells, but it causes side effects like fatigue, frequent urination, urgency, and discomfort. It's the same with chemotherapy, which means using chemical methods to kill bad cells. However, it's like Katyusha the rocket gun, of course, which kills target casually. Technically, these drugs bond with DNA and stops it self-replicating, causing all cells unable to replicate, and that is why your tumor and hair vanish at the same time. So side effects are huge, including nausea, fatigue, and increased infection risk. Finally comes the immunotherapy such as BCG. It was promising, having a dream of arousing the immune system to fight cancer, using magic to beat magic. However, such magic is hard to drive, which may seriously backfire our allies' good cells. Just think about the 2006 clinical trial tragedy. So now, please allow me to introduce the latest product from modern medicine. The target therapy new drug Enfortumab Vedotin Padcev. Since it's a drug, it's non-invasive, and since it's target therapy, it supports specific binding. Technically, Padcev is a kind of antibody-drug conjugates, or ADCs. Padcev targets urothelial carcinoma cells by binding to the NECTIN4 protein on their surface with a monoclonal antibody. Once bound, the antibody-drug conjugate is internalized, and a cytotoxic agent, MMAE, is released inside the cancer cell. MMAE disrupts microtubules, leading to cell cycle arrest and apoptosis, effectively killing the cancer cell. I know it might be quite difficult to understand, so let's change a way. Actually, Padcev is a tracking missile. Let's say a heat tracking missile. The antibody part of Padcev is the warhead which can lead the missile into the urothelial carcinoma cells by binding to the NECTIN4 protein, which is the heat source on the surface of the cell. Once Padcev the missile is in the cell, the bombs are released. In the case of Padcev, they are MMAE, which were originally carried by the antibody. The rest of the story is familiar to all of us. Target down and the good guys always wins. According to the Phase 2 clinical trial statistics released from Lancet Oncology in 2021, 46 of 89, which means more than half of the patients who have received Enfortumab Vedotin after PD-1 or PD-L1 inhibitors responded positively to the drug. And according to the Phase 3, global, open-label, randomized trial statistics released from the New England Journal of Medicine, Enfortumab Vedotin and pembrolizumab in untreated advanced urothelial cancer has even better effect than the previously best chemotherapy. However, it doesn't go with no cost. More than half of the patients involved had side effects including neutropenia, maculopapular rash and fatigue. In summary, bladder cancer is a serious and often deadly disease with various treatment options, each with its own set of challenges and side effects. Padcev represents a significant advancement in targeted therapy, offering hope to patients who have exhausted other options. While it does come with side effects, its ability to specifically target cancer cells makes it a promising option in the fight against bladder cancer. Thank you for watching. If you found this information helpful, please leave a like and subscribe for more videos on new drugs. Stay healthy and take care.